Hi, I'm Dr. Whiteman-Hoyte, fellowship-trained urogynecologist, female pelvic reconstructive surgeon, talking to you about the stitch in time. And so one of the very rare obstetric procedures that we perform is a robotic abdominal cerclage. The abdominal cerclage is a stitch that's placed around the cervix, abdominally placed, before the pregnancy becomes an issue or before dilation begins, and it's designed to hold the cervix shut to help use the cervical mucus to protect the amniotic membranes from vaginal inflammatory agents. A robotic cerclage is actually one of these stitches that's placed using the surgical robot, using 5 small incisions in the abdomen to get around the cervix and tighten the stitch around the cervix in a way that doesn't interfere with the blood supply to the uterus or cervix, and gets the stitch tightened up so that it works extremely well. It's performed by minimally invasive techniques as opposed to a large open incision. It's extremely successful and it's quick, and it can be done in the usual time frame, about 12 to 18 weeks of pregnancy. I really want to put a plug in for Tampa General Hospital. Bless them. That's where our first robotic cerclage in Tampa Bay was performed. It was actually the first robotic surgery performed at Tampa General Hospital many years ago, and it was performed by myself, yours truly, Dr. Whiteman-Hoyte, and my colleague, the late Dr. Valerie Whiteman, high-risk obstetrician at Tampa General at the time, who placed that cerclage and developed that technique, which is still in use today. We do that surgery at Tampa General here in Tampa Bay, and we appreciate the support of our partner, Tampa General, in that procedure. I'm Dr. Whiteman-Hoyte. Thank you so much for watching. Please remember to like and subscribe, and if you want to participate or you want to feel like you have recurrent pregnancy loss due to painless cervical dilatation, we're happy to see you at the Pelvic Floor Institute, and we're happy to help you be a patient at Tampa General for this really important life-saving procedure. We've done over 100 of them so far over the years with extremely good outcomes in a safe manner. Please remember to like and subscribe, leave a comment in the comment box. We'll do our best to answer as many of them as we can. Thank you so much for watching.
So usually in women with premature, recurrent, painless cervical dilatation leading to pregnancy loss, one of the things that they can discuss with their obstetrician or their maternal fetal medicine specialist is the placement of a stitch around the cervix that can actually hold the pregnancy in for long enough to allow for fetal viability to occur, and usually then lead to a delivery of a fetus or a baby that is viable outside of the womb. A cerclage is nothing more than a fancy stitch that's placed around the cervix to help prevent premature cervical dilatation and minimize the risk of having premature delivery due to painless cervical dilatation.